So let me take you now into the slides. There we go. So that looks something like a hockey rink or a curling rink or something. So I don't need to tell anybody in this room about the importance of preventing chronic disease. So in Canada, we know that 3 in 5 Canadians are living with a chronic disease, and 4 in 5 have a risk factor. So that's pretty profound. I mean, you know, you don't really have to say any more, right? We know, and the minister talked about, concerns about the sustainability of the healthcare system, cost to the economy, productivity issues. We know about the common risk factors that lead to chronic disease, and we know that it's not just about individual behavior change. We know about the importance of creating those environments and sustaining those environments that support Canadians in prevention. And we know about the importance of metrics. So I will talk a bit, Rick, about numbers. These metrics are guiding federal, provincial, and territorial governments in our collective ambition to understand and monitor how we're doing in preventing chronic diseases, and in particular, in this case, in dealing with childhood obesity. Almost 1 in 3 kids and youth are overweight and obese. We spent probably about a year working with experts in the field to develop this set of indicators in 3 areas: supportive environments, physical activity, and healthy eating. And we think that with these indicators, and remember, governments have agreed on these, and that often doesn't happen easily. But by using these indicators, we will tell Canadians a story about how we're doing collectively to tackle this important public health problem. And as they say in the management field, and as we all know, you can't manage what you can't measure. And so this provides us with the ability to use the numbers, to use the statistics to enable us to manage. It's important for us to be looking at what's happening in families, what's happening in schools and communities, and in the environments that surround them. It's important for us to be looking at the indicators of physical activity and of healthy eating. And in doing so, we can set the groundwork for making the progress that we all know we need to make. So let's talk about multi-sectoral collaboration. We've all said it's the foundation. Just want to reinforce there's a good reason for it being the foundation. Many of the levers that will have the positive effects that we're looking for on the indicators that I just showed you are outside of the health sector. And so that health supremacy notion that Anselm was talking about is passé, it's gone, needs to be gone from our paradigm and our framework. We really need to be thinking about the levers and how we leverage knowledge, expertise, reach, and resources to make real and lasting change. Canada's role with international partners is really important, and the multi-sectoral model for prevention is a feature of the international and domestic statements that are the foundations that are uniting our action and our collaboration. Canada participated in the endorsement in the development, actually, and the endorsement of the UN Declaration on Non-Communicable Diseases in 2011, and we're very committed to the international dialogue in this area, very committed. I just want to remind you domestically of some of the foundational documents. Sometimes we work on these documents and then we launch them and then we forget about them, right? So I just want to remind you that these foundational documents are still what motivates federal, provincial, and territorial governments to work with you and to do better than what we're doing now together. So just quickly want to remind you of these milestones for us. And behind all of these milestones, believe me, are days and months of discussion and negotiation and consensus building and sometimes arguments. And at the end of the day, in true Canadian fashion, we land on something that's beautiful and that provides us with exactly what we need in order to work with our governments, work with our stakeholders, work with Canadians to do something different. So remember in 2010, health ministers launched the Federal Provincial Territorial Declaration on Prevention and Promotion. It set out the frame for governments. It said this is important. Prevention is a priority. We know we need to deal with the acute care system. We know healthcare is important, but we often spend all of our time talking about that, and we need to move upstream. We need to think about prevention, invest in prevention, and do the things that will remove some of those pressures from the healthcare system. So the principles of that declaration, as governments, we all stand behind. That same year, we decided as governments, we're going to tackle childhood obesity, we're going to talk about unhealthy weights in kids, and we're going to work together where we can, and work individually where it's necessary in our jurisdictions to make things happen. And part of making things happen, and again, I thought of this when Anselm was making his presentation, there's so much we can learn from each other, and there's so little time we spend learning from each other. And so that's part of what we're doing under the Federal Provincial Territorial Framework for Action to Promote Healthy Weights. We're saying, jurisdictions have different priorities, but we can all champion particular issues in this important agenda in order for us to learn about what we can scale up and what it takes to move something that may be a very effective initiative in one community or in one jurisdiction, what it takes to scale that and move it further across the country, across provinces, wherever it needs to be to move the agenda forward. And that's a feature of the CLASP initiative that our partners at the Canadian Partnership Against Cancer are advancing. So you can see that there's a momentum and an interest in understanding how to move from the pilot project mentality into the business scale-up mentality. The Summit on Healthy Weights, the minister mentioned, for us at the Public Health Agency of Canada, it started our partnership approach with the private sector in a really big way. Before, we'd sort of been dabbling in it and learning a bit about it. The summit consolidated some partnerships for us that we are now in implementation mode with. So that was really important for us. And then just last year, when federal, provincial, territorial health ministers met, they launched the first progress report on the framework on childhood obesity. So in that report, they talked about what jurisdictions are doing. They profiled the work. They indicated the collaboration with sport and recreation ministers. And for the first time, as baseline, presented those indicators that I spoke to you about. So these are important accountability mechanisms as well. They motivate and they're accountability mechanisms. So let me tell you a bit about the agency's core business, the Public Health Agency's core business, because as we really get into our partnership action in a serious way, we need to be able to describe simply what our business is. Some of you know this very well, but for those who don't, we need to enhance the use of data for action. So the surveillance work that we do, and incidentally, we do that work for you, is intended to provide reliable data and monitoring that will help us understand trends, where we're going, and opportunities to work in particular areas where we might see a need for prevention that's being overlooked, or we might see an opportunity to bring a best practice from one spot to another. Building the evidence base, like all of you, we're really into what does the evidence tell us? And we work with our partners to build that evidence base. And we use our mechanisms like the Canadian Best Practices Portal and other mechanisms to put that evidence out there. And then putting evidence into action, that's all about the multi-sectoral collaboration that I'm going to move into next. So, you know, over the last couple of years at the Public Health Agency, we've been talking about how can we have a bigger impact in what we do. We have a federal role, we have a federal mandate, we need to stay within that mandate and and the authorities that we have from our government. But we felt like we were funding a lot of small projects and we weren't seeing a lot of really important impact. So we revamped our grants and contributions funding program and created the multi-sectoral partnerships to promote healthy living and prevent chronic disease. So it is about using our resources to create action and to leverage partnerships. So we added some, key requirements into that program. One of them is partnership is mandatory. Partnership has to include the non-government sector and the private sector. The private sector has to put in money. And in the short time, we're quite proud of this fact. In the short, and I know it's not all about money, but money's important. In the short time that the partnership program has been up and running, remember we launched it last year only, we've leveraged $11 million. So that's a really good start. It's a really good start. But even more important than that, what are we leveraging? We're leveraging social innovation. Social innovation is about bringing to bear the power of the marketplace on complex social issues that oftentimes in the past were entirely dealt with by governments. So paradigm shift again. How do we harness the power of the marketplace, the power of the business community around these very complex issues? Well, we're doing it, and you're doing it, and the provinces and territories are doing it, and our international partners are doing it, which is why I think that there is a mobilization and a momentum here that we can capitalize on. This is just sort of a smattering of examples of partnerships that we're engaged in right now, where we're working together on something that's tangible and specific. And we're seeing in our partnerships with the business community, and I'd be interested if you're seeing this as well, a shift from, that concept that's been around in the business community forever of corporate social responsibility to shared value for all partners. And it's an important shift in thinking that makes our ability to partner different and, in my opinion, much more rich. The minister talked about the play exchange that she launched just after, on the tail of the Sochi Olympics, and our partnership with Canadian Tire, CBC, and Lift Philanthropy is bringing together totally different expertise in terms of marketing, in terms of reach, in terms of developing business solutions. So this isn't just about a national campaign to get a lot of ideas into play. That's part of it. But what it's about is taking those ideas and triaging them down into those that can be developed into a business model for implementation. So It's not about consulting and say, tell us everything you ever wanted to do. Can this idea be made into an investable idea? And that's what the Play Exchange is testing. It's about the marketplace of ideas, but it's then saying what investors are interested in attaching themselves to this idea and working with an entrepreneur to bring that to the place where an investment can be made to put it into action. You know, I think we've all been, I've certainly been through this, maybe not all of you, but in my career where really good ideas come to the table, but we don't know how to do anything with them, and so they don't go anywhere. We're trying through this mechanism of social innovation, marketplace of ideas, connecting investors to ideas, partnerships, government, NGO, private sector. We're trying to more efficiently turn those really good ideas into results for Canadians. And what do we need to think about as we do this going forward? Clearly, we need to think about the parameters of partnerships. Like obviously, you don't just enter into a partnership blindly. There's values and ethics, there's governance, there's performance measurement, there's recourse mechanisms, there's all the due diligence that goes along with it, but those things don't need to be barriers to innovation. We need to work with them, but they don't need to be barriers. What else do we need to think about? We all know that Canadians are interacting with each other and with the institutions that serve them in very different ways. Technology is changing that. Public expectations are changing. The demographics are changing that. So we need, as collaborators in the area of chronic disease prevention, to be thinking about how do we capitalize on those new ways of interaction and on the ingenuity of Canadians to mobilize and to keep this important public health priority at the top of the agenda. That's the challenge for us working together as partners. And that's the challenge for the globe as we work with our partners at the Pan American Health Organization, at the World Health Organization, to really think about the strategic investments and the partnerships that we need to move to prevention in a very different way. Thank you very much.